My name is John Hare, and I've got a new idea for medicine and pharma. Matter of fact, I call it Freedom Pharma, and we spell it with an F as opposed to PH. For one main reason is because the treatment that we'd like to replace regular pharma with actually comes from a farm. But anyway, basically what we're talking about today is health versus profit. And I don't want to make it sound like I'm not trying to make profit. There's no question we want to. But one of the biggest problems that happens in pharma, and I don't even blame Big Pharma, because let's face it, what is their mandate? You know, any corporation wants to make money, but it can't be that can't be the only reason. In other words, if the bottom line is, you know, from a point of view of profit, is really what's motivating pharma, and let's face it, that's what it is. And let's again start thinking about what is pharma. Big Pharma it's a company like any company in any industry. It wants to make money. We want to produce treatments that will help people, presumably, but we want to make sure that those treatments are going to pay back, because you know it costs probably, usually going through the American Food and Drug Administration regulations to bring a drug to market. They say it's between $1 and $3 billion and 10 to 15 years to actually bring a drug to market. It doesn't matter what drug it is, and so you're going to bring drugs to market that are going to give you payback. And you know, one of the biggest problems with that is, okay, as a matter of fact, the drugs coming out of the FDA right now, new drugs coming from the that are being approved by the FDA, average price for those treatments is $115,000 per patient per year. That's pretty much out of the ballpark for most people from the point of view of being able to afford those drugs. But then they say, oh, well, we got insurance, the insurance will pay for it, and and you're only paying a copay. Well, somebody has to pay it. If that price is $115,000, I guarantee you, if the insurance company is paying a portion of it, somebody's got to be paying the insurance company, which means we all end up having to pay for your treatment at $115,000 a year. Going on that basis, it's eventually going to bankrupt the whole healthcare system, because you can't keep doing that. Anyway, and matter of fact, it really comes down to you've got to sort of start taking care of yourself as much as you can on your own. So, $115,000 a year per patient for a treatment, a newly approved treatment. And by the way, 25% of all the drugs approved by the FDA in the United States aren't approved by other regulatory agents around the world. The reason they aren't is because those regulatory agents look at those drugs and say, well, for one, they're too expensive, and we don't see the efficacy. In other words, the bang for the buck is not there. Yes, the pharma company is going to make money, but it's not really helping people in health that get healthier. One of the best ways to sort of point out the problem with pharma in general is there's a new epidemic coming, and you hear about it on a regular basis. It's called antimicrobial resistance. It's shortened to AMR. Antimicrobial resistance is where the antibiotics that we have, and we've only had these antibiotics since basically the Second World War, to treat infections. So it's been a great boon to keeping people alive longer. You get an infection that would have otherwise killed you, and now you take an antibiotic and you survive it. Well, unfortunately, what's happening is the bacteria themselves are becoming resistant to all the antibiotics that have been produced, and we haven't produced a new antibiotic for a long, long time. And guess what? We haven't, because there's no money in antibiotics. Biggest problem with an antibiotic, first of all, and again, I don't blame the industry itself, pharma. Why would they produce an antibiotic? First of all, you're going to spend all this money, the $1 to $2 or $3 billion, to get that antibiotic approved, and then because antibiotics have resistance, problems, they're going to hold your newly developed drug as long as they can without using it, because they want to keep it in reserve for when the other antibiotics that are out there stop working. Well, great, you build a new product, you spend all this money on it, and then you can't even sell it because they're holding it in reserve. So that's the first problem. Second problem is, okay, so we're dealing with a new treatment right now for C. difficile, which is a bacterial infection that normally would be handled with an antibiotic treatment. It is the approved treatments right now are vancomycin, which is an antibiotic, and then fidaxomicin, a more expensive one. And as a matter of fact, when we first started working on this, the original one was metronidazole, which doesn't work anymore because of resistance. And so now they're moving up the scale as to these antibiotics that are going to cost a whole lot of money. I think the price of fidaxomicin now is $5,600 per dose. So fidaxomicin at $5,600 per treatment That's, like I said, a pretty good amount of money that the patient has to spend by comparison to most other antibiotics. But from the pharma's point of view, they spent that $1 to $3 billion to get the product registered. Initially, it's being held back, the new drug, and the most they're going to get is maybe $6,000, because that's what the market will bear on antibiotics. And it's over in 10 to 15 days. The person gets better, which is fantastic. But pharma's not investing in that because, again, no money. Why would they do it? They've got to spend all this money to get the product registered, prove that it's safe and effective, and they can't sell the product. And if they do sell it, they only sell it once, compared to $115,000 a year per patient. Not a good investment decision from a point of view of a business that is really there to make money. That's what they're there for. And so, anyway, the other thing that has to be remembered, when you're talking about a drug, and this happened with COVID, there's no question about it, and I'm not going to even get into the COVID thing, as a matter of fact, but we were mandated to have vaccinations, to wear masks, to do all these kind of medical things. And you stop and think about it. Okay, Big Pharma has a mandate to make money. All of a sudden, there's a pandemic. Wow, what an opportunity to make money if they can get everything going in their direction. So let's face it, if we believe that this virus is going to kill us all, then we're going to scream for a vaccine or a treatment of some sort to keep us from dying from that virus. But stop and think about it. Now, Big Pharma sees a potential. As a matter of fact, some companies, and I won't mention any names, literally doubled their revenues. So they're doing $50 billion a year, which is huge to begin with, and they actually, through the pandemic, because of vaccines, doubled that to $100 billion a year. Man, what company wouldn't love that? I don't care what business you're in, wouldn't love being able to make double their revenue with all the profitability that goes along with that in 1 year or 2 years, based on the government mandating people take those vaccines. Well, stop and think about why the government mandated that. The largest lobbyist to the U.S. government is Big Pharma. They spend more money with politicians than any other industry in the world. And guess what? Guess who also spends the most money on buying media ads, sponsored by whatever pharma company we're talking about. And so when it comes down to a narrative that you want to have, let's face it. Again, I'm not blaming the companies. They're going to do whatever they can to make as much money as they can. So when COVID came along, wow, what a chance to sell a vaccine that works or doesn't work. We don't know. I'm not even going to get into that. But if you can double your revenue in one shot, fantastic. Now, an alternative would be something that maybe is less money and gives people an alternative. As a matter of fact, when COVID hit, our company, who makes oral antibodies, first in the world to make oral antibodies. Now, you might know of antibodies, monoclonal antibodies, which again, that's what Big Pharma is working on now. This $115,000 a year per patient primarily is what they call monoclonal antibodies. Monoclonal antibodies are produced in a lab, very expensive. The most notable of all the monoclonals would be a product called Humira. Humira is a treatment. It's a monoclonal antibody treatment for originally rheumatoid arthritis. So for autoimmune diseases like rheumatoid arthritis. The price of Humira, it just came off patent in the last year, was at that point $76,000 per patient per year. If you got rheumatoid arthritis, it works pretty well. Great, but you have to go in for an IV or an injection. All the monoclonals are injected. So that's where antibodies are, expensive drugs. And by the way, mostly for oncology now, that's where they're using these monoclonals for, which are cancer treatments. And that's great. Give a patient, a longer life term because you've been able to, use these monoclonals to help them. And again, you return to the company a large amount of money per year per patient. Okay, so is there an alternative to that? Well, first of all, the best alternative is let's take care of our own health as much as we can. Okay, you have an immune system that's supposed to do that, which it does for the most part. But let's face it, like anything, your immune system has a maximum capacity. So if you could add extra antibodies, and that's what your immune system, by the way, produces to keep you healthy. If you could produce, if you could somehow produce more antibodies, which you can't. Like I say, it's like, I can lift 100 pounds. I can't lift 200 pounds. So I have a maximum capacity on my muscle capacity. Your immune system is the same. So, but if you could get antibodies from some other source, not monoclonals because they're way too expensive and you have to inject them, How about an oral dose antibody, which is what we produce and have been working on since 1997. And we're seeing some pretty amazing results. I don't think Big Pharma wants to see it because, first of all, we're doing it and they're not. But second, it's not big money. And, patients can actually afford it. We've actually got a broad spectrum, what we call polyclonal antibody that you can take every day, which giving you extra immunity every single day to help. But when COVID came out, we actually, had a proposal that we made to have an alternative treatment for really probably preventing you from getting infected. And think about it, with COVID, you want to produce antibodies, and that's where everybody knows the word antibodies all of a sudden because of COVID. So you want to produce antibodies either naturally from your own immune system if you get infected with COVID, and that knocks out the virus, or you theoretically get a vaccine which is supposed to produce those antibodies beforehand, before you get infected, to the point where when you come in contact with that virus, it'll prevent you from getting sick. That didn't work with the vaccine that we had. Anyway, what about actually having antibodies produced from another source? The good news about that kind of a thing would be, first of all, you know the capacity of those antibodies, you know how many you're getting, you know how long they're going to last. Which, by the way, in your immune system, you can get a vaccination, and I've always said, a vaccine is only as good as the immune system of the person that's being vaccinated. So if you're an older person with multiple comorbidities, you can vaccinate yourself up the wazoo, and it's not going to do much. So, and that's why they're saying, oh, we've got to vaccinate the old people first because they need it more. Well, maybe, but their immune systems are crapped out to begin with because they're old. Like I can't lift 100 pounds like I could 30 years ago. My immune system isn't going to take care of me like it did 30 years ago. So why not get an external immune source to actually produce antibodies that you know the efficacy of them and you know the longevity of them? You come in, you want to go out, instead of, worrying about getting infected with a virus in the air, you give yourself an aerosol spray of actual antibodies. So when that virus, comes in contact with your receptor cells, which it has to do to actually infect you, you've got antibodies blocking them to begin with. So that was a nice way of trying to do it. Well, obviously we never got any traction because we had some guys that were working against us that had some pretty good motivation to make the traditional vaccines to sell an extra $50 billion worth in 1 year. So, hard for us to get any traction or get anybody supporting us, to help us bring that kind of a treatment to market. Meantime, we have oral dose antibodies. And I encourage you to have a look at Freedom Pharma, spelled with an F.com, and just see what we're presenting, what we're talking about. You have to take your own health in your own hands. And a simple way of doing that is just giving yourself extra immunity every day, extra antibodies every day to help your immune system generally take care of you. Take a look again, freedompharma.com, pharma with an F, and see what we're talking about. I appreciate you listening, and we'll talk to you soon.